Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better at veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Just go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need. So again, guys, welcome. And starting the cases here, first one I had mentioned is from Sarah. For case one regarding lidocaine and a CRI, she's been told lidocaine should be used with caution in cats. It could cause seizures. All that's correct. They use fentanyl and ketamine alone, and that's perfectly fine at 2 mLs per kilogram per hour. So that's definitely the way to go. Laura and Katie have had similar experiences or exposure to that. Unfortunately, Katie had some problems there, and also had another question about that with lidocaine on the larynx of cats. We used to do that. I know personally, and we never had any side effects from that, but always been worried about CRI in cats. So let's go to cover that a little bit. The reason we don't use lidocaine anymore is we use a little cannula inside the endotracheal tube, which is essentially a blunt-ended, a big diameter urinary catheter. So in cats, it fits right down in there, and we can very gently put it through into the trachea without causing any damage. And Annie Mills, who I mentioned is my licensed veterinary technician, she is impeccable. She does this by herself with one hand holding the mouth open and the other with the catheter in almost every one of our intubations. And she's amazing with that. So we don't use that, but I can see where it might be of benefit in some cases. And again, we used to use it when my technicians were not that skilled in intubation. So in effects of IV administration in thermal threshold in cats, this is the second of a couple of papers that Sheila Robertson published while she was at University of Florida, and this was back in I think the first one was published back in 2002, and that was about the time that I was working with the IVAPM to get that program developed. I was big in pain management, and so I had a lot of exposure to that, and Sheila did a lot of research in that field and was on VIN quite a bit talking about that. And as a general adoption rate goes with the gurus back then, Bob Stein and Mark Epstein and Bob Thompson and a couple other people that were big in pain management back then, they were using this as well, and it has been used for quite some time. And I think there was another question about dexdomitor being involved with that, and I think that the reason why that lidocaine lost favor and dexdomitor became one of the things people were using in CRIs is because somebody owns dexdomitor. There's a company that has probably promoted it over time. I don't know that for sure, but it makes sense. Nobody benefits from adding lidocaine. No company benefits from doing CE and getting people involved with lidocaine. So if you weren't in that small group at that time and were on VIN and the analgesic, anesthesia and analgesia part of that, you probably did not get exposure to that. So that's where I think a lot of that came to fruition. So I hope that answers your question. We used it for a while, and I think it is It is fairly safe, but you have to use your own discretion on that, and that is certainly a personal decision. So, Sarah, another quick question. Lidocaine, if you give it IV at 2 milligrams per kilogram, that is a maximum dose. We don't give it IV. We give it into the foramen next to the nerve. So as long as you're in the foramen and you're using 0.2 mLs of bupivacaine or lidocaine, doesn't matter which, you're going to be fine. The main thing is that you really don't want to use lidocaine in the blocks because lidocaine is very short acting. Bupivacaine is the drug of choice to use for local blocks. We seem to get about 6 to 10 hours of analgesia from that, and maybe more based on a study done at Wisconsin. But for a general rule, that's very safe. We've been doing thousands of these in cats at that dose for years, using 0.5% bupivacaine, and we used to use half lidocaine, half bupivacaine. Never ever had any problems with that. So let's go on to the next question. Good question here, Katie. Wondering about the rationale for use of Serenia in the symptomatic management of refractory stomatitis. Well, when you think back to Serenia, Serenia is an NK1 antagonist which selectively binds at the postsynaptic membrane and prohibits substance P from binding and sending those ascending pain signals up to perception. So in that mechanism, it's excellent for chronic pain in conjunction with ketamine that binds the NMDA receptor, which are the two biggest receptors that cause chronic pain persistence. And I know Lester Mandelker uses that a lot with pentoxyphylline, with Serenia and pentoxyphylline for chronic stomatitis cases, and recommends it. We have not used it for that. Not that it's not good to use, we just have not used it. But I would certainly consider it, and I think you could as well. So when we go back to that whole mechanism of pain, not only does substance P cause the vomiting, and that's why Serenia is effective, it also causes the ascending signals to go up more rapidly and more intensely to the higher centers, and so blocking that NK1 receptor in that postsynaptic membrane is really effective in theory, and I think based on what people say, they're very happy and pleased with how it works. So I hope that answered your question. I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org/INV.